mynews.studio.
Imagine this for a moment. COVID-19 isn't even in the top 10 causes of death worldwide anymore. How did that change happen so quickly?
Today's date is 2025-10-18. The most recent data published in the Lancet shows that global life expectancy has returned to pre-pandemic levels. Right now, women are averaging 76.3 years and men 71.5 years. That's a significant turnaround after the drop we saw during the pandemic.
Absolutely, and it goes beyond just the numbers recovering. The main causes of death have also shifted. Back in 2021, COVID-19 was the leading cause worldwide, but by 2023, it had fallen all the way down to 20th place. Heart disease and stroke are back at the top of the list.
That's a rapid change in just 2 years. Do you think vaccines were the main factor behind this?
Vaccines were definitely central, especially for people over 60 who accounted for most COVID-19 deaths. High vaccine coverage among older adults led to a fast drop in severe cases and deaths. But it wasn't just vaccines. New treatments and improved clinical protocols also played a big part across all adult age groups.
So would you say that countries with strong vaccination programs saw the biggest improvements in life expectancy?
Yes, exactly. Countries that quickly rolled out vaccines and provided antiviral treatments saw the most dramatic rebounds. In contrast, younger age groups who weren't as heavily affected by COVID deaths didn't see large changes in their life expectancy. The impact by age is quite distinct.
And when it comes to health systems, has the pandemic changed the way they operate on a daily basis?
It has, very much so. One of the main lessons has been about the need for resilience and adaptability. During the peak of the pandemic, routine care for chronic diseases was often disrupted, which led to rises in deaths from things like heart disease and diabetes. Now health systems are investing in things like telemedicine, better surveillance, and more flexible models to keep care going, even during emergencies.
Are those changes likely to last, or could we just slip back into previous habits as the pandemic fades from memory?
There's a strong effort to make these changes permanent. Strengthening primary care, connecting public health with clinical services, and reaching out to vulnerable groups who fell behind during the pandemic, these are the current priorities. The aim is to make sure future crises don't set back progress on chronic diseases.
Still, the recovery hasn't been uniform everywhere. What's behind those ongoing gaps in health outcomes?
It mostly comes down to access to vaccines, treatments, and solid healthcare infrastructure. Places with weaker health systems or less access to vaccines have seen slower recoveries in life expectancy. That's why global organizations and governments are now focused on making sure resources are distributed equitably, building up health systems in low and middle income countries, and paying attention to things like education and nutrition.
Are there specific plans or strategies in place to close those gaps, or is it still mostly discussion at this stage?
There's a lot happening already. International cooperation on pandemic preparedness, targeted funding for communities that need it most, and using data to monitor and address equity gaps. But it's going to take sustained effort over time.
So this really isn't just about recovering from COVID-19. Since life expectancy reflects the broader health of societies, if we don't address health inequities, are we at risk of setbacks with the next crisis?
That's exactly the concern. The rebound we're seeing shows what's possible, but it also exposes the weak spots. Chronic diseases remain the leading causes of death, and unless we keep applying what we've learned, progress could easily stall.
So, to sum up, life expectancy has recovered. COVID is no longer at the top of the list, but the big test is whether health systems can keep up with both old and new challenges.
That's it. We've seen that recovery is possible, but keeping up the momentum and making sure it's shared by everyone is what comes next.
Thanks for joining us. Today we looked at why global life expectancy bounced back, how vaccines and health system changes played a role, and what's ahead for health equity and chronic disease.
Thank you for listening. This episode was brought to you by mynews.studio. You can try it out for free.